hand therapist could be an occupational therapist or a physical therapist that has gone through training for more or less 5 years of experiencing hands only. Hands meaning the upper extremity, that knows the science of rehabilitation and treatment, and that keeps up with all the new advances in medicine. We usually work very closely with hand surgeons, and I have the privilege to work with one, and also with orthopedics and plastic surgeons that work on the surgery or conservative treatment of the upper extremity. In hand therapy, we can see from the very conservative, from a nerve compression all the way to a very elaborate tendon transfer or a tendon repair that requires a lot of very minute work, requires splints that we make for the patient depending on their condition, depending on the swelling, the treatment, the surgical procedure. And so we pretty much receive fractures of the elbow, the shoulder. We see a big range of different diagnoses. I think that, well, pretty much the hand therapist, since we have been devoting so many years just to study the upper extremity per se, and all our continuing education is based on upper extremity only and the rehabilitation of the newest procedures. That makes us more specialized than any other occupational therapist that is maybe a generalized occupational therapist or somebody that has experience in, any other diagnosis other than orthopedic hand therapy. Mainly we use a material called Aquaplast or Orthoplast. We place them in the water. They mold into the patient's hand. Every patient has a different characteristic. You might have somebody that has a lot of swelling. You might have somebody that has stitches. Somebody that needs a specific joint to be stretched, to be rehabilitated. We do splints that are static, that you don't move, such as, for example, somebody that needs to be stretched in extension of the elbow, so we make them conforming their hand. It's something that you cannot find over the counter. Or we can have somebody that needs their fingers to be stretched in a position because they are too stiff, so we use Merritt's. This is a static progressive splint, because progressively you bend the fingers down. And we have dynamic splints made with elastic bands that mimic the function of a tendon. It could be a flexor tendon or it could be an extensor tendon. And the measurements that we do have to be so exact that you cannot just go and buy them, because every hand is different and people's hands change as they progress. I just love to treat people, and I like the challenge of treating the upper extremity just because it's so complicated, and it's so much to learn, and I love making splints, and I love to see how people progress by using their splints and by coming to therapy. We laugh a lot. We try to have a good time. We try to build a good rapport with the patient. We pretty much we treat them as close as family as we can. Sometimes we even feel that we worry more than they do. We try to make a very stressful and a good experience for the patient when they come to visit us.